Hello, my name is Dr. Biyanat Briyanon, an interventional cardiologist from Perfect Heart Institute here in Bangkok, Thailand. I have Dr. Sasko Kedev with me. Hello, Dr. Sasko Kedev.
Hello, thank you very much for the opportunity.
And how does an interventional cardiologist find time to climb Mount Everest and every tallest peak in the world?
You know, I think time is life, and life is time, and time is all we have. So I think we have to find some time to use it in a most intelligent way and find to understand life. So as far as I am concerned now, and from this point, I can tell that the time that I spent on Everest cleared my mind and somehow made me focus on the most important things in life.
And how does such incredible success help in STEMI intervention? I'm sure one lesson is you never give up.
So in STEMI intervention, frequently we are going on the edge of life and death. But that's life and death on somebody else. And on a big mountain, particularly on Everest, when you're entering the death zone over 7,600 meters, you're endangering your own life. So all of us need to be aware what it means when your personal life is in question. So it helps us how we can actually look at the risks of STEMI and the risks we are overcoming.
And I learned that you are the world expert of transradial approach intervention. Is there any situation that you will not use transradial approach for STEMI intervention?
I'm coming from a dedicated radial center. It's in our hospital, University Hospital in Skopje in Macedonia. So we are doing around 800 STEMIs per year. And in the last 2 years, we are 100% perform all STEMI interventions through the wrist. It does not mean that all the time we use a radial artery. Sometimes when radial is not available, our second choice is ipsilateral ulnar artery. And in the cases when, I'm talking about the right wrist, in the cases where right wrist is not available, artery access from the right wrist is not available, we moved to the left wrist. So we have 2 more access options. It means left radial and left ulnar artery. Of course, in cases with a cardiogenic shock, in patients with impaired LV function, in the cases when we have to use LV assist device like intra-aortic balloon pump, in those cases are the only sample of using femoral access, but only for LV access. In all of those cases, again, we are doing PCI through the wrist approach.
And what are the biggest challenges of performing primary PCI in your country?
So I think it's very important to have a education of patients and educating the population to recognize the symptoms and to come early in the hospital on an appropriate center for performing those life-saving procedures. In our country, because it's a small country, it's only 2 million people, our size is pretty much like size of Switzerland or Slovenia. So it is approachable. Most of our PCI centers are approachable within 2 hours. So we are trying to educate, first of all, population to recognize the symptoms and to have time for early treatment.
What is your view regarding performing PCI in non-culprit lesion in patient coming in the setting of acute MI?
That's a great question. We are very soon will join the complete trial. It's one of the largest international trial where we'll compare culprit artery stenting in a STEMI situation in comparison to staged stenting on the whole significant lesions in STEMI patients. So I personally believe there is no one-fits-all situation. In patients where we have several significant lesions beside the culprit lesion, in patients with impaired LV function, I think it is very important to perform also the other vessels to fix other lesions, but not in all situations, because sometimes we know that we can decrease the TIMI flow in a non-carpet lesion. So I think individual approach at this stage is very important. So to recognize which patients will benefit most. And of course, after the finish of randomized trials like complete trial, we'll have answer of this very important clinical question.
Well, thank you so much, Dr. Kedev, for joining us today.
Thank you very much.